Hello, welcome to another episode of Library Connections. My name is Ryan Livergood. I'm the Executive Director of the Warren-Newport Public Library. On Library Connections, not only do we look at what's going on at the Warren-Newport Public Library, but also what's going on in our community and in Lake County. And today I have a very special guest. I have Jefferson McMillan-Wilhoit with us. He is the Director of Health Informatics and Technology for the Lake County Health Department. Jefferson, thanks for joining me today.
Thanks for having me, Ryan.
I'm really excited to talk to you because we've got something very important to talk about. And specifically, that's the Lake County All Vax portal. I think our viewers know that there are COVID vaccines that are out there that are starting to become available. And I appreciate you coming on with me today to talk about this portal. So first of all, should we just take a look at it, show people where to go?
Yeah, that'd be great. So for everyone who lives or works in Lake County, you should go to allvax, ALLVAX .lakecohealth.org. And that's going to take you to this page. And our AllVax system is our community registration portal for you to tell us that you want to get a COVID-19 vaccine. This is a way for us to know how many vaccines we need to make sure that we have so that everyone in Lake County gets a vaccine, as well as to make sure that you know where your place in line is. And so that we can have that two-way communication so that all of your questions are getting answered and that we're making sure that you're getting your vaccine as soon as we have it available in our phase, you're in the right phase. So this is we tried to make it really simple, Ryan, and I hope your viewers will find that true. It's real easy for us to get started if we're a new registrant. You just hit that little get started button. If you happen to speak a language that isn't English, we've got Spanish in there right now. You can always click that drop-down box at the top and flip between English and Spanish. And all you really need to do is give us your first name, your last name, your email, and then accept the terms of registration. You click next, it's going to send you an email to reset your to set your password up. You'll set your password, you'll finish with a few medical screening questions that'll put you in the right phase for the vaccination. That way we know when to let you know that the vaccine's ready for you. When it is, you'll get an email from this system telling you it's time to schedule. You'll come back and schedule your appointment either with us or with one of our community partners, and then you'll go get your vaccine. And it's as easy as that. We've tried to take all of those logistical headaches and hurdles out of the equation for our community members.
Yeah, Jefferson, this is, I think, a well-designed portal, and it seems to be very easy to use. Also, what I like about it too, there's a nice FAQ. So if you do have questions, and people obviously have a lot of questions, right?
Yeah.
Everything from, I have a pre-existing condition, it's not listed. How is that handled? What about scheduling a second dose? Because we know that we need to get a second dose. Other things like that. So I think this is really excellent. Are there specific things about the portal that have confused people, though? Have you heard feedback and people have contacted you and your team and had questions?
Yeah, I think and Ryan, just to point out, you're absolutely correct. That FAQ page is the best place for anyone to go if they have questions, either about the vaccine itself or about our AllVax portal. You don't have to log in order to get to that FAQ. You can just go right to the website and hit FAQ at the top. And we're constantly updating those questions with the things that we're seeing maybe a little bit confusing. And we're also constantly making updates and additions to this portal. So I know a lot of our community members have made suggestions about how we can make our portal better, and we've implemented them pretty quickly. And we're really proud of that. And the reason that we're so proud of that is because that means that our community is involved in this process, and that's really what we wanted. I think one of the most frequently asked question that we get and that has confused people is about scheduling and when they become eligible. So the system knows, based on the questions that people, the answers to the questions that people put into the system, it knows what phase we are in. And the Centers for Disease Control has outlined these phases to make sure that we are equitably distributing our vaccines. So a lot of people probably know that we're in phase 1A right now. 1A is all of our healthcare workers, as well as all of our long-term care facilities, skilled nursing facility, and nursing home residents. Next week, the state as a whole will be going into phase 1B, which will be those who are over age 65, as well as our frontline essential workers. And there's a whole long list of industries that qualify as a frontline essential worker. And so based on the questions, that people answer in the AllVax portal, the system's going to generate an email when it's time for you to go schedule. Again, we wanted to make it really easy. We didn't want people to have to constantly be checking back in to know when they're going to get their vaccine. So just sit tight, be patient, and the system's going to let you know. If you can see that you're registered in the portal, we know you're there, and we're going to let you know when it's time to get your vaccine.
That's great information, Jefferson. And I'll mention for viewers, we might even already be in 1B by the time this recording gets released. So yeah, but it's good to know that we don't really have to worry about it. If you've registered, you're in the system, you'll be contacted. That's very good to know. Jefferson, for people that are hesitant to register, because we know the last study that I saw from Pew Research Center, overall, it was 60% of people definitely or probably would get vaccinated. So there's potentially 40% of Lake County out there that is may have some questions about the safety of the vaccine. So can you address that at all?
Yeah, so the first thing, Ryan, is that signing up for the AllVax portal doesn't mean that you have to get a vaccine. It just means that you're telling us that you might be interested for a vaccine and you want to be notified when it's your turn. You're not taking away a spot from anyone, but you're helping us to plan to make sure that we have enough vaccines available when we need them. And so I would encourage everyone, even if you are hesitant and you're thinking, oh, I don't know if I really want to get the vaccine or not, register anyways, because it gets your place in line, and it also will help you to know when that time comes and when you actually do have to make a decision. So let's talk a little bit about the safety of the vaccine. And I know that that's a big thing for everyone. So the FDA, the Food and Drug Administration, did a lot of analysis on the research that each of these pharmaceutical companies provided to them. And those pharmaceutical companies did what are called controlled clinical trials. And basically what that means is that they had a lot of people, some of whom got the drug, some of whom got the vaccine. Other ones got what looked like the vaccine, but it wasn't. It was what's called a placebo. It didn't have anything in it. It didn't have any effect on them. And they did a lot of comparisons. And what both the Pfizer vaccine and the Moderna vaccine, which are the two that we're using now in the United States and have been authorized by the FDA, those both had high effectiveness. Pfizer was up in the 95% range, which means that of those who are going to get the vaccine, only if 100 people got the vaccine, only 5 of them would end up where it didn't really work when they got it. And that's a huge deal, because when we think about things like the flu vaccine, that's a 60 to 70% efficacy. So this vaccine is really, really effective. And of course, there's going to be side effects, and I don't want any of your viewers to think, oh, there's going to be no side effects at all. I will tell you from personal experience, I just got my second vaccine dose this week. The second one was worse than the first one. My immune system was going really, really full bore, trying to make all those antibodies that I need to be able to eventually fight off the virus if I ever were to get exposed to it. And I think one of the things that I've come to do, and what I suggest for everybody, is celebrate the fact that your immune system is working as good as it is. If you've got some side effects from the vaccine, that's a great thing, because that means your immune system is working. And if you don't have any side effects, that doesn't mean your immune system isn't working. This vaccine affects everybody differently. But the bottom line is that the FDA and the CDC would not have given authorization to a vaccine that wasn't safe. They wouldn't have let the American people be exposed to something that wasn't safe. They spent months poring, or at least a month, if not a couple of months, poring over this data to make sure that it was as safe and effective as it could possibly be. And they have been working with these pharmaceutical companies while they were doing the clinical trials to make sure that the right data was getting into their hands so that they could evaluate it appropriately. And the last thing to know is that although it seems like these vaccines were developed really quickly, I know that's been a conversation of hesitancy for a lot of people. It's like, wow, we started like 9 months ago and then we got a vaccine. Well, the technology that's underlying these vaccines have been in development for years. And so it was just, the companies were waiting to see where they needed to apply that technology, where that technology could be best applied. And it just so happened that the COVID-19 pandemic hit right as they were ready to be able to start doing that. And so these vaccines have been in development for many years. The technology has been tested. These vaccines have been tested on a lot of people, and the FDA and the CDC have authorized them. And so for those viewers who might be feeling a little hesitant, I would really encourage you to read as much as you can. Go out and look at the FDA and the CDC. Watch some videos from trusted partners like the Warren-Newport Public Library and others, and really make sure that you're making the decision that's right for you, that's based in the science.
Jefferson, that's great information. Thank you for sharing those insights. We're almost out of time. Is there anything else you want to share with our viewers today before we have to?
I think the biggest thing is just make sure to get registered in the AllVax portal. That is the way that we're going to be able to communicate with you when it's time to get your vaccine. And share it with all of your friends and your family. We know that the best way for people to get engaged in this process is to hear it from somebody they trust, and who trusts us more than our family and our friends. So if you signed up for the AllVax portal, I encourage you to at least go and talk to 2 of your family members and friends and make sure that they've signed up for the AllVax portal too.
That's great. Jefferson, thank you for your time today. Thanks for joining us on Library Connections. Viewers, thanks once again for joining us. This has been Library Connections. Have a great day. Take care.